This is a tutorial on how to use the prescription writer in Eaglesoft. What you'll want to do is double check and look and make sure that you have this RX writer up in your quick tabs. If you don't, you can also use this activities button and scroll down to RX writer here. Either way, you will get to this screen. From here, you will want to click on New for creating a new prescription. A majority of the time, you're going to be creating a new prescription for your patient. It is possible you will be refilling an item, but for the most part, you will be selecting a new prescription. Once you select a new prescription, you will have this form come up, and you will need to select the patient. Whether or not you are in the patient's file, this will come up. So if you have John Doe as one patient, but you need to write a prescription for Jane Smith, you can still be in John Doe's file and pull up this prescription for Jane Smith. So go ahead and open your person list and find your patient. And you'll want to use that. Once you have your patient selected, you'll notice your patient ID, their name, their age, their date of birth, and the RX form type. This is where you want to keep it as a generic form. You don't want to change your RX form type to anything other than a generic form. What you do want to change is your prescription template, your RX template. Click on this drop-down menu, and you'll see a listing of different medications that you can use. These are already placed into the computer. For some reason, if there's another medication that you need to use that is not listed in the computer, then you will need to use a different method. So for our example, let's go ahead and say that our patient will need to use Paradex, one of the most commonly things that we prescribe here in our office. You notice when you select your RX template for a Paradex, the drug automatically changes to Paradex also. And the template here is set up so that we have one 16-ounce bottle to dispense, and then the pharmacy right now is selected as none. Currently, we have one pharmacy in our system, and that may change. As time goes on, we may be entering more pharmacies in. If your patient happens to have a preferred pharmacy and it is in our list, then you may select that. If not, just go ahead and leave it as none. If this is a prescription they're planning on filling at our office, then go ahead and leave that as none also. Right below that is you have your refills. You have your number of refills, or the patient can refill it as needed. So you'll simply just go ahead and make a notation of how many refills you want. Or again, you can just select as needed. The next line down is your RX instructions. Now again, this template, as with some of the other templates, will keep that RX instruction is already in there. But you may want to have some specific instructions for your patients, such as swishing 2 times a day for 30 seconds, and do not rinse or eat, drink for 30 minutes after use. Okay, so any specific instructions that you have the patient, that you want them to do, this is where you're going to put that in. Now for provider, our default right now is set for Dr. Young. What you will want to do is, for the provider, you will want to put your pod instructor's name in. The reason why you'll want to do that is because for prescriptions that dental hygienists can write, your pod instructor will be the person. You, not being a licensed hygienist, cannot do that yet. So the provider will be your pod instructor. And for right now, we'll just leave that as Dr. Young. And then you have your way that you can make it valid. So if it needs to be done within a day or two, you'll want to go ahead and select that. If it doesn't matter, you can do it a few days later, or a couple weeks later, or even just leave it blank with no alert there. One thing to remember is that when you do select on somebody else, you will have this prompter come up that says it does not have a valid DEA number. And that is okay. Hygienists do not have a valid DEA number. Once you are done, you want to go ahead and click Print and Save, and you'll get this prompter come up saying your prescription has been printed. No longer will you need to go into the setup. It has been, the setup has been set for you. As you go through, you'll get to be able to see that you'll have chart notes for the patient noted there, and you can simply see that right here on the note history area. I hope this is helpful for your prescription writing in the future. This is a tutorial on how to use the prescription writer in Eaglesoft.